Given the recent increase in inmates encountered by the Gallia County Sheriff's Office patrol deputies and/or committed to the Gallia County Jail with major mental health diagnoses or undiagnosed neuroses, it has become necessary to scrutinize the Ohio Revised Code as to how to proceed with getting this population the mental health intervention that we cannot provide to them while in custody. Historically, when we contemplate the need to complete a blue slip on a subject, the question is raised, is he or she suicidal or homicidal? We like this question because it is finite and clear, but it does not fully encompass the scope of what the law permits. So let's consider what that means by reviewing ORC 5122.10, Emergency Hospitalization. The law is styled as follows. Section A1. Any of the following who has reason to believe that a person is a person with a mental illness subject to court order and represents a substantial risk of physical harm to self or others if allowed to remain at liberty, pending examination, may take the person into custody and may immediately transport the person to a hospital or, notwithstanding Section 5119.33 of the Revised Code, to a general hospital not licensed by the Department of Mental Health and Addiction Services, where the person may be held for the period prescribed in this section. A psychiatrist. B, a licensed physician. C, a licensed clinical psychologist. D, a clinical nurse specialist who is certified as a psychiatric mental health CNS by the American Nurses Credentialing Center. E, a certified nurse practitioner who is certified as a psychiatric mental health nurse practitioner by the American Nurses Credentialing Center. F, a health officer. G, a parole officer. H, a police officer. I, a sheriff. As we are often first to be contacted with regard to a person in mental health crisis, we move to the top of that list very quickly. So let's break down how we currently handle these cases, as well as some alternate options. As I previously mentioned, it is a misconception that officers must articulate either suicidal or homicidal ideation or intention in a subject prior to completing a blue slip. While the presence of those factors certainly simplifies the process, they are not always present in those in active and serious mental health crises. Mental health crises may also have many causes, including physiological triggers, such as urinary tract infection, diabetic complications, or substance abuse, that can be alleviated by medical attention received as a result of a blue slip. Let's go over an example. If it can be articulated that a subject, by their verbiage and/or physical behavior, is suffering a form of mental health crisis to the point where they cannot care and take responsibility for themselves, they inherently represent a substantial risk of physical harm to themselves. A subject's behavior can also be volatile and unpredictable towards others in a manner that, if it continues to escalate, will represent a substantial risk of harm to others. Recently, an elderly female who was arrested for an outstanding warrant out of Lawrence County arrived at the Gallia County Jail, presenting with the inability to coherently communicate. When a question was posed to her, she responded with verbiage having nothing to do with the question. Often these responses would devolve into gibberish. She could provide little personal information, nor could she provide information about her family despite what seemed like a valiant effort to do so. Astonishingly, she had somehow been medically cleared by Holzer Medical Center just prior to arrest. Lawrence County, when informed of her condition, declined to accept her on the warrant, and after 3 days of trying to find a nursing home or relative to place her with, I articulated in a blue slip that, due to the condition of the inmate's mental health, she could not take care of herself, and therefore placed herself at substantial risk of physical harm. She was then discharged, and HMC took responsibility under the blue slip. So, when faced with a call involving a subject in mental health crisis, please examine all factors that could affect the subject as it relates to substantial risks of harm to self or others. These factors can include, but are not limited to, medical history, prescribed medications, whether they have not taken any, enough, or taken too much, recent injuries, and whether or not persons are available to take responsibility for the subject. In the case of the confused female inmate, a family member was contacted prior to the issuance of a blue slip, but declined to take responsibility for her. We'll now move to the first sentence of Section E. A person transported or transferred to a hospital or community mental health services provider under this section shall be examined by the staff of the hospital or services provider within 24 hours after arrival at the hospital or services provider. Once you have placed the subject under the care of the hospital and passed them the blue slip, the burden of care shifts to the hospital, no matter what their staff might say. While we do not wish to abuse the blue slip or use it as a weapon to accomplish an aim, ORC 5122.10 clearly indicates our duty as well as the duty of the medical facility. Finally, if faced with one of these situations, which are all unique, do not hesitate to discuss it with the shift sergeant or officer in charge. 2 brains are better than 1 when navigating these situations. I hope you found this video helpful. As always, thank you for your time and be safe.